Welcome to another episode from the Veterinary Research Channel. Today, we delve into a significant study published in the Journal of Veterinary Internal Medicine in 2024, authored by Charlie McKenna and colleagues. Their work investigates the reasons behind euthanasia in dogs diagnosed with urothelial carcinoma, a type of cancer affecting the bladder and urethra, that were treated with either chemotherapy, radiation therapy, or a combination of both. Understanding why pet owners ultimately choose euthanasia for their beloved dogs following cancer treatment is crucial. Clients naturally seek to know the final cause of their pet's passing after undergoing what can be extensive and emotional treatment. However, the specific causes of euthanasia, particularly concerning urinary obstruction in dogs with urothelial carcinoma that have received treatment, have not been thoroughly documented in veterinary literature. This lack of specific information makes it challenging for veterinarians to provide owners with a clear prognosis and understand the factors that most significantly impact a dog's quality of life at the end of their battle with this disease. This study aimed to address this gap in our knowledge. The researchers hypothesized that in dogs treated for urothelial carcinoma, the primary reason for euthanasia would be complications arising from the original tumor itself, such as the blockage of the urinary tract. This blockage, known as urinary obstruction, can cause significant pain and distress, ultimately leading to a decline in the dog's quality of life. Urothelial carcinoma accounts for approximately 2% of all reported cancers in dogs. The initial signs of this cancer are often vague and related to the lower urinary tract, including difficulty or pain when urinating, blood in the urine, or frequent urination. As the disease progresses, dogs may exhibit signs related to the local growth of the tumor, such as a ruptured bladder, a distended and painful abdomen, or, importantly, urinary obstruction. The cancer can also spread to other parts of the body, a process known as metastasis, leading to signs like enlarged lymph nodes, lameness, difficulty breathing, or weight loss. In most cases, urothelial carcinoma is found in both the bladder and the urethra. However, tumors can also develop or grow locally in other parts of the urinary system, including the prostate, ureters, and kidneys. The local progression of these tumors can impede the flow of urine, potentially leading to a complete blockage and a condition called hydronephrosis, where urine backs up into the kidneys. Currently, there is no single, universally accepted standard treatment for urothelial carcinoma in dogs. Local treatments can include surgical removal of part of the tumor, radiation therapy, laser treatment, procedures to block blood flow to the tumor in the prostate, or the placement of urinary catheters or stents to relieve obstruction when it occurs. Systemic treatments, which aim to address cancer cells throughout the body, typically involve the use of non-steroidal anti-inflammatory drugs, often combined with chemotherapy drugs like mitoxantrone, carboplatin, doxorubicin, vinblastine, or chlorambucil. Unfortunately, urothelial carcinoma generally does not respond well to chemotherapy, with most drug regimens achieving an objective response in less than 40% of cases. Combining multiple chemotherapy drugs or using different drugs when the initial treatment fails may help to extend survival times. However, when the cancer has spread to the lymph nodes, survival times are often significantly shorter. Similarly, while maintenance treatment with a drug called chlorambucil after other treatments have failed can provide some benefit, the presence of distant metastases, prior treatment with certain anti-inflammatory drugs, and involvement of the urethra can negatively impact its effectiveness. Regardless of the treatment approach, dogs with urothelial carcinoma are often euthanized due to their disease, whether it is because of local tumor growth or the spread of the cancer, typically within 1 year of diagnosis. Without any treatment, most dogs will die or be euthanized due to the complications arising from the local progression of the tumor. While treatments are becoming more advanced in controlling the local disease, predicting the likelihood of life-limiting metastatic disease can be difficult for owners because the specific reasons for death have not been a primary focus in previous studies. Some earlier studies have provided glimpses into this issue, noting that in dogs treated with certain drug combinations, a significant proportion of deaths were related to the urothelial carcinoma. Another study looking at radiation therapy combined with other treatments found that in dogs experiencing local treatment failure, most died due to this local progression, while others succumbed to metastatic disease. Even in dogs where the local tumor was controlled at the time of death, some still died from metastasis, while others passed away from unrelated causes. Given the limited and inconsistent documentation of the cause of death in previous research, and considering the possibility that the balance between local and metastatic failure might be shifting with more advanced treatments, the researchers in this 2024 study aimed to retrospectively investigate the reasons for euthanasia in dogs with urothelial carcinoma treated at their veterinary institution. Their central hypothesis remained that the failure to control the local tumor growth, primarily leading to urinary obstruction, would be the most common reason for euthanasia. To conduct this study, the researchers reviewed the medical records of dogs treated at the Ontario Veterinary College Health Sciences Centre Companion Animal Hospital between January 2011 and March 2020. The study included 59 client-owned dogs that had a confirmed diagnosis of urothelial carcinoma, had received treatment with chemotherapy or radiation therapy or both, had undergone an initial abdominal ultrasound examination performed by a board-certified radiologist, and for whom the date and cause of death were known. Dogs that were only treated with non-steroidal anti-inflammatory drugs were excluded from the study. The researchers collected a comprehensive range of data from the medical records. This included information about the dog's breed, sex, age, the initial clinical signs and how the cancer was diagnosed, blood test results, findings from initial and follow-up X-rays and ultrasound images, the location of the tumor, the presence of any spread of the cancer, the types of treatments received, including specific chemotherapy drugs, the number of treatments, the details of radiation therapy if given, and whether non-steroidal anti-inflammatory drugs were used, any reported emergency visits, the cause of death, and the main complaint at the time of death. In some cases where additional information was needed, the referring veterinarians were contacted by phone or email. To understand the location of the cancer at the time of diagnosis, the initial ultrasound reports were reviewed and categorized into 4 groups: bladder only, prostate only, urethra only, and multifocal, meaning the tumor was present in more than one location. Tumors located in the bladder were further classified based on their specific location within the bladder. The apex, the ventral neck, the trigone, a triangular area at the base of the bladder, or diffuse, indicating widespread involvement. This detailed classification was performed by a single board-certified radiologist who reviewed the ultrasound reports and images. The cause of death for each dog was carefully classified into one of 3 categories: death due to local progression of the urothelial carcinoma, specifically including urinary obstruction or other local disease progression, death due to the spread of the urothelial carcinoma to other parts of the body, or death due to a health issue not related to the cancer. Determining the cause of death involved a thorough and systematic approach. The researchers reviewed the medical records, all diagnostic test results, imaging reports, and any notes documenting communication between the pet owners and the veterinary staff leading up to the euthanasia appointment. If a dog was not euthanized at the Ontario Veterinary College, records from both the specialty hospital and the referring veterinarian were evaluated. If the cause of death was not clear from the available records, further information was obtained by contacting the primary veterinarian or the specialty clinician involved in the dog's care. Urinary obstruction was defined based on imaging, clinical signs, laboratory results, findings from a post-mortem examination if one was performed, or a combination of these factors. An elevation in kidney values on blood tests alone was not considered evidence of urinary obstruction without supporting evidence from imaging studies. Local disease was considered the cause of euthanasia when signs of urinary obstruction were documented. Metastasis was considered the cause of euthanasia when the spread of the cancer was clinically documented and there was no clinical evidence of primary tumor growth or obstruction that was significantly impacting the dog's quality of life, based on a review of the medical records. The researchers used statistical methods to analyze the data, calculating the median overall survival time for all dogs and looking for potential factors that might contribute to urinary obstruction. A statistical significance level of p less than 0.05 was used to determine if any observed associations were likely to be meaningful. The results of this retrospective study provided valuable insights into the reasons for euthanasia in dogs with urothelial carcinoma. The study included 59 dogs that met the predetermined criteria. The characteristics of these dogs, including their age, breed, and initial clinical signs, were consistent with what has been reported in earlier studies of urothelial carcinoma. The median age at diagnosis was 10 years, with a range from 4 to 14 years. The study population consisted of a slightly higher number of neutered males and spayed females. Mixed breed dogs made up 20% of the group, and the most common purebred dogs were West Highland White Terriers, Shetland Sheepdogs, Beagles, and Yorkshire Terriers. The most frequent initial complaints reported by owners included blood in the urine, straining to urinate, and urinary incontinence. In a smaller number of cases, owners reported complete inability to urinate, increased thirst and urination, loss of appetite, or weight loss. The diagnosis of urothelial carcinoma was primarily confirmed through tissue samples obtained either by catheter-assisted biopsy or during surgery. In a smaller proportion of dogs, the diagnosis was made based on the examination of urine sediment or fine needle aspiration of the prostate gland or lymph nodes. It is notable that none of the dogs in this study were diagnosed using commercially available urinary antigen tests. At the time of diagnosis, all 59 dogs underwent X-rays of the chest and ultrasound examinations of the abdomen. These initial staging tests revealed evidence of metastasis, or spread of the cancer, in 9 dogs, involving the lymph nodes, lungs, liver, and skin in various combinations. The primary tumor was most commonly located in the bladder only, followed by the urethra only, then the prostate only, and finally in multiple locations simultaneously. When the tumor was in the bladder, the most frequent specific locations were the trigone, followed by diffuse involvement, the apex, and the ventral neck. All 59 dogs received treatment for their urothelial carcinoma. The vast majority received chemotherapy, and a significant portion of those also received radiation therapy. A small number also underwent surgery. The chemotherapy protocols involved 6 different drugs given individually, including mitoxantrone, vinblastine, carboplatin, doxorubicin, chlorambucil, and tosarenib phosphate. The median number of intravenous chemotherapy doses administered was 5. Additionally, a large majority of the dogs were treated with a nonsteroidal anti-inflammatory drug, either meloxicam or piroxicam. A striking finding was that a large percentage of the dogs had at least one unscheduled emergency visit that did not result in euthanasia. These visits were most commonly due to concerns about partial or complete urinary obstruction. These emergency visits occurred both during and after the completion of the planned treatment protocols. Following the initial staging, all dogs had follow-up abdominal ultrasound examinations, with a median of 3 such examinations per dog. A smaller number also had repeat chest X-rays. Many dogs had these follow-up ultrasounds relatively frequently, especially within the first few months after starting treatment. Shortly before euthanasia, a significant number of dogs had undergone recent abdominal ultrasound examinations. Post-mortem examinations were performed on a small subset of the dogs, and the findings from these examinations generally supported the conclusions about the cause of euthanasia that were drawn from the medical records obtained while the dogs were alive. In a few of the necropsy cases, the cause of death was attributed to metastatic disease, local disease, or a non-cancerous condition. Interestingly, a notable proportion of dogs developed hydronephrosis or hydroureter, indicating a backup of urine in the kidneys or ureters, either at the time of diagnosis or during the course of their disease. While most of these cases were linked to the progression of the urothelial carcinoma, in a few instances, it was attributed to the side effects of radiation therapy and resolved over time. In a small number of dogs, kidney failure resulting from this urine backup was the direct cause of euthanasia. Similarly, a small percentage of dogs had partial or complete urinary tract obstruction at the time of diagnosis, and a significant number more developed this complication during the follow-up period. In a few cases of complete obstruction, urethral stents were placed to help restore urine flow. The study's findings strongly supported the initial hypothesis. Local disease progression was the primary cause of euthanasia in the majority of dogs, 62%, that were euthanized due to their urothelial carcinoma. Most of these dogs, 77% of those euthanized due to local progression, were euthanized because of partial or complete urinary tract obstruction, which was diagnosed based on imaging or clinical signs such as abdominal pain and the inability to urinate. Post-mortem examinations in some of these obstructed dogs confirmed the clinical diagnosis and revealed significant invasion of the tumor into surrounding structures like the urethra, ureters, trigone, and prostate. While metastasis was also common, occurring in over half of the dogs in the study either at diagnosis or during follow-up. The most common sites for metastasis at the time of euthanasia were the lymph nodes, lungs, and bones. In a smaller number of cases, metastasis was observed in the liver, abdominal cavity, skin, eye, heart, and adrenal gland. In one instance, abdominal spread of the tumor was noted after a fine needle aspiration procedure. Despite the high rate of metastasis, it was deemed the cause of euthanasia in only a minority of the dogs, 38% of those euthanized due to urothelial carcinoma. Post-mortem examinations in some of these cases confirmed the presence of metastases in organs like the lungs. The median overall survival time for all 59 dogs from the start of treatment until death from any cause was 339 days, with a wide range observed among individuals. No further statistical analysis of survival was performed due to variations in treatment approaches across the study population. 9 dogs in the study, 15%, died or were euthanized due to reasons unrelated to their urothelial carcinoma. These other causes included conditions like severe degenerative disc disease, other types of cancer, chronic kidney disease that predated the urothelial carcinoma diagnosis, unexpected respiratory arrest, cognitive decline, sepsis related to a clinical trial drug, and suspected gastric ulceration. The categorization of the cause of death in these cases relied on the clinical judgment of the veterinarians based on medical record information and communication with referring veterinarians. For the 50 dogs, 85% that were deemed to have been euthanized because of their urothelial carcinoma, the most frequent presenting complaints at the final veterinary visit were loss of appetite, inability to urinate due to obstruction, abdominal pain, and lethargy. Notably, in a significant portion of the dogs with confirmed urinary obstruction, there was also evidence of metastasis. In the few dogs that had urethral stents placed to relieve obstruction, the eventual reason for euthanasia was not local disease but rather the spread of the cancer to the lungs or bones, or a suspected gastric ulcer. The researchers found that none of the factors they analyzed, such as the type of treatment, the sex of the dog, the overall location of the tumor, or the specific location within the bladder, were significantly predictive of urinary obstruction. The discussion section of the study highlights the key finding that local disease progression, particularly in the form of urinary obstruction, is the most common reason for euthanasia in dogs with urothelial carcinoma, even in those that survive for a relatively long period. This finding underscores the ongoing need to improve treatments that focus on controlling the primary tumor and preventing or managing urinary obstruction. The fact that a high percentage of dogs required emergency visits, often due to urinary obstruction, further emphasizes the significant impact of local disease on their quality of life. The researchers noted that the signalment and initial complaints of the dogs in their study were consistent with previous reports on urothelial carcinoma. They also observed a difference in the primary method of diagnosis compared to some older studies, with histology being more commonly used in the study, likely due to an increased awareness of the risk of tumor seeding along the needle tract after fine needle aspiration. The metastasis rate observed in this study was consistent with previous findings. However, the researchers acknowledged that this rate might be an underestimation due to the limited number of post-mortem examinations performed. They also pointed out that while the frequency of lung metastasis was within the previously reported range, it might have been higher if thoracic radiography had been prioritized more consistently during staging. The higher rate of bone metastasis compared to some earlier studies was also noted. Despite the significant occurrence of metastasis, the study clearly indicated that local disease progression was the more frequent driver of euthanasia decisions. In the majority of these cases, urinary obstruction, most commonly in the urethra, was the critical factor. The researchers also observed evidence of kidney damage or failure in many of the obstructed dogs, likely due to the intermittent or complete blockage of urine flow. They emphasized the challenge of definitively determining the cause of death in older dogs that may have other concurrent health issues alongside their cancer. Interestingly, they found that even when metastasis was present in a dog with obstruction, the euthanasia decision was typically attributed to the local disease based on clinical judgment. Conversely, in rare cases, a dog classified as being euthanized due to metastasis was later found to have a significant urinary obstruction that was likely a major contributing factor. These examples highlight the complexities involved in accurately determining the cause of death in retrospective studies relying on clinical data. The researchers acknowledged several limitations of their study due to its retrospective nature. These limitations included the relatively small number of cases, incomplete medical records in some instances, and the lack of standardized treatment protocols and follow-up procedures. The involvement of multiple clinicians in patient care also introduced variability in assessment, treatment decisions, and the interpretation of imaging results. A significant limitation was the reliance on clinical judgment, based on a review of medical records and communication with owners and referring veterinarians, to determine the cause of death, as post-mortem examinations were not routinely performed. The type of imaging used to assess the extent of the disease could also have influenced the detectability of lesions in different locations. For example, abdominal ultrasound might underestimate the extent of urethral involvement compared to more direct methods like urethropscopy. The researchers recognized that the subjective nature of assigning a cause of death based on clinical data could have introduced some bias, which might be minimized in future, prospectively designed studies that include routine post-mortem evaluations. Despite these limitations, the findings of this study provide important insights and highlight the critical need for continued efforts to improve treatment strategies for dogs with urothelial carcinoma, with a particular focus on achieving better local control of the primary tumor. The high frequency of urinary obstruction as a cause of euthanasia suggests that future research should prioritize the development and evaluation of innovative approaches for managing local disease and preventing this debilitating complication. Future prospective studies investigating new local control methods should include careful assessments to document the occurrence of obstruction and clearly determine whether euthanasia results from the failure to control the local tumor or from the burden of metastatic disease. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.